Medicare Simplified. The number one reason people call me for help with Medicare is because Medicare is confusing. It's completely understandable. Medicare is a maze with its own set of rules, procedures, and choices with penalties and coverage gaps if it's not done correctly. Add to that the overwhelming amount of mail, phone calls, and emails that you receive as you approach your initial eligibility. No wonder your head spins. Getting this right is crucial for a secure retirement, as nothing is more important to your financial well-being and peace of mind than a solid foundation of health insurance. Medicare serves as that essential cornerstone. Hello, my name is Sue Diamond, an independent Medicare broker here with Health Options New York. So what is Medicare? Medicare is health insurance primarily for adults 65 and older. So I always like to say, imagine a pie chart divided into 5 parts. And the first part is Medicare Part A, which is hospital insurance. And this helps cover inpatient care and skilled nursing facility care, home health care, and hospitals. The second part is Medicare Part B. This covers medical insurance, and that includes services from doctors and healthcare providers, outpatient care, preventative and diagnostic lab tests, and durable medical equipment. So together, Parts A and B are known as Original Medicare, insured by the federal government. Now, skipping over Part C just for a moment, let's talk about Medicare Part D. And this is a standalone prescription drug coverage, offering insurance plans approved by Medicare and sold by private insurance companies. Medicare Part C, also known as Medicare Advantage, is an alternative to Original Medicare. Advantage plans offer Part A and Part B type coverage through private insurance companies and typically bundle prescription drugs and other benefits together as well. So there's 2 paths to get your Medicare coverage when you enroll in Medicare. And the first is Original Medicare, which is Part A and B coverage insurance through the federal government. And under this option, you can see any doctor or provider that accepts Medicare anywhere in the US. For most people, there's no premium for Part A. However, there is a deductible for hospital admissions, and that's $1,632 for each benefit period in 2024. For Part B, everyone needs to pay an annual deductible of $240 in 2024, and on top of that, there's a base monthly premium of $174.70, which might go up depending on your income bracket. With Part B, you get 80% coinsurance, which means insurance covers a big chunk, but you're responsible for the remaining percentage. So to put it simply, with Medicare Part B, you pay 20% of the cost for the services you receive. So if your doctor charges $100 for a visit, you pay $20, and Part B would take care of the other $80. You can also add Medicare supplement coverage, known as Medigap, for an extra premium. This is super helpful for covering gaps in Part A and Part B, like the Part A hospital deductible and the Part B 20% coinsurance. Plus, you can get a standalone Part D plan for prescription drug coverage, which you can update each fall as your medications and plan benefits change. It's important to note that Original Medicare does not cover most drugs, except in specific situations. Part D plans have a monthly premium, an annual deductible, and drug co-pays as well. The second option available is Medicare Advantage plans, also known as Medicare Part C, which are provided by private insurance companies. These plans consolidate benefits from Part A, Part B, and Part D, often including additional discounts on health services not covered by Medicare, such as dental, vision, and hearing care. Medicare Advantage plans usually work through a network, like a HMO or a PPO. You might have you might have seen them advertised by celebrities, often highlighting low or even zero monthly premiums. So it's important to keep in mind that these plans are available regionally, often limited to specific counties or states, and may offer different services depending on where you are. So if you come across a plan on TV, make sure to check that it's available in your area and if your favorite service providers are included. This pay-as-you-go model means you'll need to meet deductibles, co-payments, and co-insurance as you use medical services, with annual out-of-pocket maximum costs reaching $8,850. Some plans may have lower limits in 2024. So how do you decide? Well, this is the fifth part of Medicare, or the pie, so to speak, partner. Many people often discuss what aspects of Medicare are most important, and we're here to break it down for you. So understanding your current health, family dynamics, and retirement situation is the first step in this process. We take the time to listen to your wants and needs, explaining your options in simple terms. This way you can arrive at a personalized Medicare coverage solution that suits you. We can recommend the ideal Medicare supplement plan along with the appropriate insurance coverage. If you're considering Medicare Advantage plans, we'll check your doctor's participation and drug coverage. We'll also evaluate your current medication list to help you find the most cost-effective Part D prescription drug plan. Additionally, we'll guide you in covering important healthcare needs beyond primary care, including dental, vision, hearing, and long-term care. So as health plans can change over time, we remain committed to ensuring you always have the right coverage. As independent brokers, we never charge you a fee for our time or services. We understand that Medicare can be confusing, which is why we invite you to book a Medicare Clarity call and transition from confusion to clarity. So give me a call, 845-594-4818, and let me help you on your Medicare journey.